Welcome to the Spots Podcast.
All right, guys, I'm Michael Albright.
My name is Rebecca Castro.
I'm Amy Valero.
I'm Victoria Rodriguez.
And I am Saul Ibarwen.
All right, guys, the point of this podcast is to inform and spread awareness to college students who may have bipolar 2 disorder or someone struggling with bipolar 2 disorder. 3% of college students have been diagnosed with bipolar 1, 2, or hypomaniac episodes. Did you guys know that?
I did not know that.
It didn't. Nope.
Yeah. Well, bipolar 2 disorder is a mental health condition characterized by alternating episodes of depression and hypomania. Unlike bipolar 1 disorder, bipolar 2 disorder does not include full-blown maniac episodes, but instead presents with milder hypomanic episodes along with severe depressive episodes. This distinction is crucial in understanding how bipolar 2 disorder affects individuals, particularly college students who must navigate academic, social, and personal challenges while managing their symptoms. College students with bipolar 2 disorder may struggle with maintaining consistent academic performance due to fluctuating energy levels and mood changes. Very difficult. Hypomaniac episodes can lead to bursts of productivity and creativity, but may also result in impulsive actions and difficulty focusing. On the other hand, depressive episodes can make it challenging to complete assignments, attend classes, and engage in social activities. Additionally, balancing personal relationships, extracurricular activities, and financial responsibilities while managing mental health can contribute to an increase in stress levels, making college life difficult for students with bipolar 2 disorder.
So I'm going to talk about what causes bipolar 2 disorder. So the exact cause of bipolar 2 is unknown, but there are some main genetic factors and other life causes that lead to bipolar 2. So the main one is stressful life events such as childhood trauma and neurological conditions such as TBI or strokes. So these conditions lead to symptoms presenting earlier in life, and also the genetics. They play a big part, especially if someone in your family has a history of bipolar 2 disorder, because you're at a bigger risk of having it yourself. Mm-hmm. And so as a college student, there are different factors that play a role in everyone's lives, and one of those is the uncertainty of going to sleep. We never know what time we're going to finish homework or just any activities. So having a dysregulated sleep schedule leads to more frequent hypomanic episodes. And then another risk factor for hypomanic episodes is the use of alcohol and drugs. So these are things that trigger them, and so they should try and stay away from these and better a sleep schedule.
Mm-hmm. So the symptoms of bipolar 2 include at least one major depressive episode and at least one hypomanic, but no manic episodes at all. Symptoms can cause changes in mood and behavior that can't be predicted, and this can lead to a lot of distress and cause you to have a hard time in life. So bipolar 2 is not a milder form of bipolar 1, it's a separate diagnosis. But while manic episodes or bipolar 1 can be severe and dangerous, people with bipolar 2 can be depressed for longer periods of time. And about 60 to 70% of the hypomanic episodes in bipolar 2 occur immediately before or after a major depressive episode. So do you guys know the difference between mania and hypomania?
No, they sound pretty similar.
Yeah. So mania and hypomania are different, but they have the same symptoms. So mania is just more severe than hypomania, and it causes more noticeable problems at work, school, and social activities, like getting along with others too. And mania can also cause a break from reality known as psychosis. Mm-hmm. And major depressive episodes include symptoms that are severe enough to cause you to have a hard time doing day-to-day activities. And some other symptoms are like anxious distress, melancholy, and psychosis. And the criteria to be diagnosed with bipolar 2 is having at least one or past hypomanic episode and a major depressive episode, but no manic episodes. So according to the general DSM-5, the presence or 5 or more of the following symptoms daily, nearly, or every day for a consecutive 2-week period that is a change from baseline or previous functioning. And these are depressed mood for most of the day, anhedonia for most of the day, significant weight loss or weight gain, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue, loss of energy, feeling of worthlessness, decreased concentration, and recurrent thoughts of death. And to meet the criteria, at least one of the symptoms must be depressed mood or anhedonia, and the symptoms must not be attributable to a substance or a general medical condition and causes functional impairment.
So I find that really difficult for a person who has to struggle with these things for 2 weeks and they don't know why, or especially if they're undiagnosed, they just think something's wrong with them and they don't know what it is.
Yeah, but treatment and management can definitely help with these types of things. So according to the Mayo Clinic, types of medication and doses of medication depends on the symptoms of the person experiencing bipolar 2 disorder. I found this super interesting because that means that the treatment plans for those with bipolar 2 disorder, they're very individualized. So medications used to treat bipolar 2 disorder, they include mood stabilizers, and these are basically used to control the episodes of hypomania. So an example includes lithium, also known as Lithobid. Another type of medication is going to be antipsychotics, and these may be prescribed along with the mood stabilizers to control hypomania further. So an example of this includes olanzapine, also known as Zyprexa. Antidepressants are also used, but they need to be prescribed with a mood stabilizer or an antipsychotic, because antidepressants alone can trigger the episodes of hypomania like altogether. So some examples include selective serotonin reuptake inhibitors, or SSRIs, known as Prozac and Zoloft, and also Wellbutrin. Benzodiazepines are used for short-term help, and they basically treat hypomania, agitation, and sleep problems. So some examples include lorazepam and alprazolam. So along with medication, therapy is also really important. So according to the National Alliance of Mental Illness, also known as NAMI, therapy for methods used for bipolar 2 include cognitive behavioral therapy, and this is basically aimed at helping individuals with bipolar 2 disorder identify negative thinking patterns and behaviors, which can reduce depression. There's also family-focused therapy, or FFT, and this is basically aimed at educating families on bipolar 2 disorder, and it allows them to discover support methods to help the individual with bipolar 2. And it was shown in trials conducted by the University of Colorado and UCLA that individuals with bipolar 2 disorder who had received the FFT therapy had overall less severe mood symptoms and functioning after a 1 to 2 year period. There's also interpersonal and social rhythm therapy, and this can basically help individuals with bipolar 2 regulate their daily routines and help with their sleep schedules, which overall helps with their overall mood stabilization. There's also dialectical behavioral therapy, or DBT, and this is basically administered, it could be administered through an individual or a group setting like us right now, and it serves to teach just distress tolerance and emotional regulation, as well as interpersonal and effectiveness. There's also going to be lifestyle adjustments. Navigating college is really hard for college students in general, but for those students with bipolar 2, it can be more challenging overall. And so it is recommended that college students with bipolar 2 disorder, they maintain a consistent sleep schedule, they maintain a healthy lifestyle, such as proper diet and regular exercise. They have self-care and mental health days, and staying social. I think it's a really important part of college in general. And also adhering to treatment, such as medications and therapy.
And so going back to what you said about therapy, as a college student, we may not know where to look or like who to seek help to. Is there any resources on campus that they can go to receive this help?
Yes, they do actually. I'm glad you brought that up. There's really good services here on campus actually. One is UTEP Counseling and Services, which provides support and counseling for students dealing with mental health issues, including bipolar 2. And the phone number is right here, which is 915-747-5302. The next one is Student Health and Wellness Center. Offers basic medical services. They can refer students to specialized mental health care providers. And that phone number will be right here as well, and is 915-747-5624. And El Paso has really good services too for that. And one is El Paso Behavioral Health Systems. Offers comprehensive health and mental services, including those for mood disorders like bipolar 2, and the website is right here. Also, NAMI, El Paso, another popular one here on town. National Alliance on Mental Illness offers support groups and educational resources for those affected by mental illness. And I was gonna ask you guys, do you see any challenges with treatment?
I would definitely say adhering to your medications and therapy.
Yes. Especially for like college students, maintaining a consistent treatment plan can be tricky. Balancing medication schedules, therapy sessions, and academic responsibilities, it requires good time management. Additionally, the stress and social dynamics of college life could sometimes exacerbate symptoms or make it difficult to stick to treatment routines. I'm sure all of us get really stressed out with the midterms and papers and essays and tests that we have to do here.
Yeah.
So I can just imagine someone with a bipolar 2, really stressful stuff. And actually, I have a personal story I would like to share with you guys. I have a friend who was diagnosed with bipolar 2 at age 15. And, before he was diagnosed, he had like really hypomanic episodes and really depressing episodes.
Mm-hmm.
So he was really confused, and he was like, what's going on with me? And he had an idea. He purchased a calendar, and he was gonna put an arrow pointing up and then put an arrow pointing down on each day, and just so he can track his mood swings and all that.
Mm-hmm.
And 2 weeks would go by and with all arrows pointing up, and during that time he was really active, really hyper, really concentrating on his homework, creative. He's a musician, so he would write at least, I remember, 4 to 5 songs a day while having time to study and all that. And I was really impressed. I would be like, well, like how are you doing this? And he said he just had the energy for it. And 2 weeks would go by, and his mood would totally, change. He would get really depressed, didn't want to get out of bed, and he just had a really hard time with that. And now that he's 35, he hasn't really conquered it, but he's been able to manage it with medication and treatment. And you guys have any final thoughts?
I think it's really great, your personal story, because it kind of ties in everything that we talked about overall.
Yeah, especially like his student life, like how he was very productive at times, and then other times he just couldn't manage to do anything.
Mm-hmm.
So
Yeah,
it was a great
that's
story.
Really great story. So with that said, thank you all for listening to the Spots podcast.
Bye.
Bye.